You are watching the DocTalk show.
So you're still watching the DocTalk show, and we're talking about nosebleed. We just discussed briefly the causes of nosebleed, events that will occur within the nose. And in this discussion, we're going to talk about events that can occur outside the nose, but will still present as a nosebleed. These events are categorized as systemic conditions. So, Dr. Back to our ENT specialist. I'll start with Dr. Etima. Are there any other conditions which can occur outside the nose but will present as a nosebleed?
Yes, they are. Things like infections. Earlier we talked about Ebola. I like to give the example of Ebola. Viral infections like Ebola can present with a bleed in the nose. Infections like syphilis can also present with a bleed in the nose, because some of these diseases would have target effects within the nose and can make a patient present with bleeding from the nose.
Okay.
Things like other infections like rhinosinusitis, or what people commonly call sinuses.
The sinuses, yes.
So infections like rhinosinusitis can also cause bleeding within the nose.
Okay.
Yeah.
How about Dr. Omar?
Yes. We said infections local. Now infections that are
Systemic.
things, or infections that may want to present with nosebleeds, but they are from afar. Okay.
Okay. And that's mainly because of effects within the blood vessels?
Yes.
Yes.
Kind of a systemic
So
cascade
these
of
are
reactions.
diseases that will have effects in the blood vessels, but also they have effects within the nose as an organ on its
I
own.
see.
Yes. Otherwise, the patient can bleed from other areas as well, like we see in Ebola.
Okay. Other than infections, any other conditions that would
Yes.
bring about a nosebleed?
We said bleeding can come from the anterior part, or what you call the front part, and sometimes the behind part. Okay. We have culprit for things that are systemic, things that are outside the nose, to present as bleeding from the behind of the nose. Now, the most culprit in this scenario is hypertension.
Okay.
What you would rather call pressure.
High
blood
blood
pressure.
pressure.
Yes.
Okay.
Now, because this is common in more of adults, just like you know, hypertension is more in adults. So the next time you see a patient and is this age, 40 or 35 and beyond, and they say they are nose bleeding, the first thing you want to know when they get to you, after trying to arrest the bleeding, is do they have high blood pressure?
In other words, you'd need to check their blood pressure and make sure that it's falling within the normal range.
Yes.
Is it a very common finding?
Nose
bleeding, hypertension.
I would say whether it is very common as a word, I wouldn't know. But
Okay.
it's
But
quite
it
common
can
enough
also
that it
show
presents,
can present as a
that
sign.
people who have high blood pressure actually
present
bleed.
again.
Okay.
Okay.
And just like what we were talking about as blood pressure, most people in adult ages take a lot more alcohol than the rest of the community. The older you get, the more likely that these people take more alcohol than others.
So alcohol
So
too.
we're saying
will cause-
alcoholism as well brings about this. And what does it do?
How does it
Alcohol,
cause a nosebleed?
Alcohol generally, one of the organs that's affected most is the liver. And the liver is very important in forming what we call clotting factors. So clotting factors are things that are necessary for you to form a clot. Like if
Okay.
you have an injury, say you cut yourself, there are things within the liver that are supposed to help you to be able to heal that, to stop the bleeding
The
in that
ingredients.
injury.
So there are substances
So clotting
produced
factors. So
by the
alcohol
liver. Yes.
will generally kill your liver, and in the process it will affect your clotting factors which are within the liver. So alcoholism, like you see, it's something that affects not only your social life, but it will also have effects on your nose.
I think by the time...
also share
yes.
with you something.
Yes,
Really.
yes.
You've seen people who drink alcohol and they start sweating.
Yes,
They
that's
sweat a
true.
lot. So what is happening is still the same science. Blood vessels are swelling. They are
Becoming
getting dilated.
larger.
Yes.
Okay, they are becoming larger. There's too much pressure within those blood vessels. And what is next? When you increase the pressure within, they bleed. So alcohol, as much as it goes to the liver, has a long-term effect, and it's up. Your liver kills it. It's out the clotting factors. The most immediate thing that would happen is vasodilating, or blood vessels getting wider, and then too much gush of blood, and then you end up bleeding.
Maybe
Okay,
also
yes,
speaking socially,
Yes, please.
generally alcoholics will have a higher risk of being involved in fights.
Yes.
Okay,
No,
so
yes. Or in
the
accidents,
trauma,
or-
yes.
Or accidents, for that matter.
But okay, talking about other causes, things like anemia, when your blood level.
What is anemia? Yes.
Okay, let's simply putting it, we'll say having a low blood level. Okay, but when this blood level is low, usually there are other cells also within the body that may go a bit low. Okay, and research was done in eastern Uganda, and it showed that most of the patients, a research of about 150 children, showed that children with sickle cell anemia were at a higher risk of bleeding from the nose.
How common was the bleeding in those
I think it was about
the sickle children?
When two groups were compared, the non-sicklers and
versus
the
the
normal
sicklers.
children, it was about 60% a higher risk in the children who had sickle cell anemia
Okay.
to those that did not have sickle cell anemia.
Okay, so that's another interesting finding. So alcohol,
And
conditions
then
that cause low,
Like you can
low blood,
imagine,
like
for
sickle cell
example,
anemia.
Yes. We're saying anemia, and we're saying the commonest type of anemia that would have you bleed in this instance is probably the chronic one, because you would have acute anemia or acute low blood levels secondary to say trauma. You had trauma and you bled out, so you have little blood in your system. It's not a common occurrence that you will bleed from the nose when you have that. But when you have chronic anemia as a presentation, chronic low blood levels, the incidence increases.
Yeah.
So a case in point is the sickle
Sickle cell anemia.
Yes, so also keeping in touch with the point of anemia, in medicine there are conditions that primarily affect the blood, diseases of the blood.
Yes.
Yes, and they too can present as anemia.
That's
so
really a wide range.
are there
They
some
can start
blood
with,
diseases that?
yes, you would start with tumors, for example. A leukemia is a tumor. If you have
It's
Or a
a
cancer.
type
Or a
of blood.
cancer.
It's a type of
It's
blood.
really
Blood
a
cancer.
blood
thing.
disorder. Yes.
Yes. So
Yes.
leukemia is a tumor. Is a
It's a
cancer
cancer
of
in
the
the
blood.
blood.
Yes.
Okay. And that there is an increased chance that people with leukemia would bleed or would
That's
present with bleeding, and it might be the first sign that you see
Very true,
before
yes.
you realize that, hey, this is what it is, and this is what we're supposed to do about this.
Okay.
But there are other things.
Yes.
So many common ones, or rather uncommon for that matter.
Earlier on, we talked about drugs,
Yes.
the ones that act locally, the cocaines, but drugs that we swallow to work in other areas can also cause bleeding within the nose. The most
Like
common
which
are,
examples?
okay, the most common are the drugs that are given to try and thin out clots, or drugs that are taken to prevent clots.
To prevent
Things like
blood
aspirin.
clots. Yes.
Yeah, and then there is another drug called warfarin.
Yes.
Yeah, it's given for patients who are at a risk of forming clots. So it thins out these clots.
So in the
But
event, yes,
it
In
can
the event
also
of thinning
cause-
out, it prevents
it would- yes,
the body
it would
from.
prevent you
clotting,
from clotting,
and then in
as
the
well.
end you start bleeding.
Okay.
Also to
So
add on to that,
maybe just come back. So if a person is on those drugs and they start bleeding, could it mean that are they taking overdose? What?
Not necessarily. They may still be within their normal therapeutic doses,
Okay.
but
But it can be an
But it can be a
incidental
sign.
occurrence.
it's a sign
of,
that the match that you're taking might need to be reduced by your
Yes.
doctor.
Okay.
So what we are saying, we're not telling you, whoever is on this medicine, that you should reduce the medicine by yourself.
No.
These
No,
medicines
they
are-
should,
the
under the
medicines
guidance of a
should
medical
be done
practitioner.
under the guidance of a doctor.
Yes.
But it's not just the drugs that thin out the blood that risk here. Fexofenadine is a drug that treats allergies. Okay. Now you're taking it to stop the allergic reactions. Yeah?
You
It's
mean,
in the
do you
same
mean the
class like
nasal,
cetirizine,
the
for
allergies
Yes.
within the nose?
Maybe
yes.
the more common drug in that group would be cetirizine, like he's saying.
Yes.
Oh, okay.
Yeah.
But the one that has been, this research has been done on, and it usually brings more of that, is the newer generation of fexofenadine, a
That
drug.
can cause
Now,
bleeding.
what are we saying in this case? When someone comes with nose bleeding, they should tell their doctor that, you know what, I have nosebleed today. But previously, I was taking this drug, that drug, the other drug. I was involved in this, or I have this, and maybe I think I have this. My family has this. So you look at a global scenario.
Take
where-
the
Okay.
patient as a whole.
We take the patient as a
before
whole.
you come up and say, you know what, this is the issue. This is the issue. At the end of it, you might miss the scenario.
Another
Okay,
thing,
yeah. So just to recap, so you're saying the causes can be the local, as you've elaborated, whether it is trauma or it's infections or some disease like tumors within the nose, or it can be systemic occurring outside the nose, but will present as bleeding.
Yes.
All right? Okay.
You are watching the DocTalk Show.